Hi, this is Dr. Nick Vanterhayden. I'm the incrementalist here with incremental insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, and we've been helping companies reopen during the COVID pandemic and continue operating safely. We've spent a lot of time over the past 30 weeks, Nick, talking about prevention and how we keep safe environments, create safe workplaces, continue to operate during the pandemic. We really haven't spent much time talking about the issue of treatment. And interestingly enough, we'll be discussing at the end of this session. There is a webinar coming up that I think our audience would find very useful, discussing COVID-19 patient management at home in the hospital today, an essential conversation. And as I said, we'll get to that at the end. But really, Nick, from a physician perspective, and for our audience, what are the current treatment options available for COVID-19?
Well, so this is such an important question because as you'll hear, we don't have a lot in our toolbox. So the first and most important current treatment is don't get it. So follow all of the advice that we have, which is, physical distance, face covering, proper hand washing, cleanliness. And next piece of advice, non-medical, prevent the spread. So that means home isolation, protecting yourself, protecting others by following all of the things that we know work. This is the most important thing because when it comes to treatment, so we know that a fair proportion of these people have mild disease, although to be clear, what we don't know is how long the impact is downstream. So while there are long-term effects, we've certainly seen the long haulers. We talked with some of those folks, the survivor core. Look at this. You've got this increasing number of people that are having increased effects. So even if you think you have a mild disease, maybe there's some long-term consequences. In the first instance, it's basic supportive therapy, Tylenol, antipyretics that bring your temperature down, everything that you would do for flu. We may or may not use antibiotics. And to be clear, that's not for treating this disease because it's a viral disease. It's for treating any associated infection. And then if you are unlucky enough to get into hospital, one of the first things that we do is anticoagulate you. That's thin your blood, because it turns out this disease is not a respiratory disease. It is, to be fair, but it has other impacts on the lining of the vessels and is causing clots and problems as a result of that. So anticoagulation is proving to be helpful. Intensive monitoring. The one thing that we found that's really helping is steroids. By the way, that's something we've used for years. This is a long existing therapy. It's just good news that we found it to be so helpful. And then when it comes to intensive care, we're giving oxygen. We try and do this, if at all possible, without a ventilator, sticking a tube. So we pronate, so we put you on your chest, facing down to the floor. That seems to improve things. But if we have to ventilate you, that's sticking a tube down. That's all really essentially quite unfortunate from an outcome standpoint. And then the last ditch attempt is something called ECMO, which is supportive therapy that says basically when you use a machine that's going to replace your heart and lungs. And by the way, doesn't work always terribly well because there's all sorts of complications. So we've got some treatments, but they're very limited at this point.
So one of the areas we focused on a lot has been testing because there are so many EUAs out there for all these new tests coming out. And interestingly enough, there are EUAs for some treatment options. And as I understand it, Nick, could you walk through, I guess there are 3 EUAs for treatment options at this point?
So think about that. I'm not sure. I could be misquoted, but I'm pretty sure there's at least 70 from a diagnosis standpoint, which is good news. So there's lots of work. But in terms of treatment, there's only 3. And what are they? Well, Remdesivir, we'll come to that in a second. Convalescent plasma, which is taking plasma from the survivor core, who have been very generous and gone into the blood bank and given their plasma, and that's proving to be helpful. And then this electrocore, which is an external stimulator. We'll be talking about that and sharing a little bit more detail about the webinar that talks about that in a second. But when it comes to those 3, that's it. And probably the most challenging aspect of this is that the WHO just released a meta-analysis. What's a meta-analysis? Well, that's taking all the trials that are going on in lots of different places. In this case, just from a data standpoint, over 400 hospitals in 30 countries. So this is pretty good in terms of data. They had over 11,000 adults in a randomized, here's the important thing. So they put them in one arm or another. And by that, I mean, some people got the treatment and others didn't. They got placebo and they were blinded to that. So they didn't know. They counted the deaths. They looked at the mortality. And unfortunately, remdesivir proved to be ineffective. It was not giving you a significant improvement in either the length of the severity of the disease or in terms of mortality, so death. And that's really, quite frankly, unfortunate. I mean, I think we were hoping. So remdesivir is a broad spectrum antiviral in the same way that we talk about antibiotics, but we've not had a lot of success with that. And they didn't just look at that, by the way. So it wasn't just that. And just to the folks that keep banging away on this hydroxychloroquine, that was in the study as well. Guess what? No effect. Stop with this concept of this stuff is working. There is no data. We've studied it and we've shown that it's not giving effectiveness. The idea that we would try and conceal that is just, quite frankly, preposterous. And then there was Lopinavir and Interferon. Some people may have heard of those. Lopinavir, another antiviral used in HIV quite relatively successfully. That's one of the diseases that we've had success. None of them. So they had them in all of the arms and sometimes in combination. And unfortunately, it showed no effect. So unfortunately, there's not a lot to use at the moment in terms of opportunities for treatment.
That really is unfortunate, as you talk about. And it's, you think about this, I'm wondering from that EUA perspective with remdesivir, if they'll do something like they did previously where they had authorized an EUA and then pulled one back. I guess we'll just have to wait and see on that. So given that situation, what's coming down the pike? Is there anything else we're looking at?
Well, so certainly, I'm sure folks will have heard of monoclonal antibodies. Just a quick section on what that is. The body makes antibodies. If we can identify what those antibodies are and make them in a test tube and then give them to you, that might boost our immune response. That's essentially one of them. Regeneron was one of those that they're testing. Maybe works, maybe not. The other big one is obviously vaccines, and there are a huge number of trials ongoing, but they take a long time from a safety standpoint, mainly because we have to find people that are likely to be exposed to this virus. Well, you know, good news, bad news. If we're in a country where there's a lot of that virus going on, then that's a good population to address and put into that study. But we're still waiting on those results, and it's going to be a while.
Wow.
So let's talk in the last section, what's coming up in this webinar. I think there's great opportunity to hear from some really astounding people talking about this, Fred.
Yeah, this is a fantastic webinar coming up, and we'll have a link below so you can get to it. It's called COVID-19 Patient Management at Home and Hospital Today. It's an essential conversation, and it'll be coming up this October 28th at 11 o'clock Eastern. Incredible faculty. It'll be moderated by Dr. David Shulkin, who we all know is the 9th Secretary of Veterans Affairs. Dr. Sten Lindahl, who's the Chair Emeritus of the Nobel Committee in Physiology and Medicine Prize, is also speaking. And, we just had a recent Nobel that we talked about with Dr. Doudna in chemistry, but he was actually the Chair Emeritus of that committee now. Dr. Jennifer Pena, who's the medical director of the Global Executive Medicine and the former physician to Vice President Pence.
Wow.
We'll also be joined by Dr. Paul Currier, the Director of Respiratory Care Unit and the Director of Quality for the Division of Pulmonary and Critical Care at Mass General, and Dr. Peter Stotz, the Chief Medical Officer for National Spine and Pain Centers, and also the Chief Medical Officer of electroCore, one of the companies with an EUA. So a fantastic opportunity to hear from folks about treatment and how that's being advanced, as well as some of these EUAs and maybe some more of the information coming out about remdesivir in that study.
What a brain trust to join in. So, your opportunity for that webinar coming up, go to the link. It's a fantastic set of speakers.
Well, thanks so much again, Nick, for this update. Looking forward to joining that webinar. This is Fred Goldstein with Accountable Health. Thanks so much for joining us this week.
And I'm Dr. Nick. I'm the incrementalist here with incremental insights for better business, better health.